Welcome. This is the training for the Four Directions Hub Clinical Viewer. My name is Dr. Peter Ziegler. I'm a family physician and currently a contractor with Indian Health Services Office of Information Technology. As an introduction, this session is going to provide introduction and training for the Four Directions Hub, or 4DH Clinical Viewer. This is the user interface for viewing patient information that is shared on the 4DH. The training is beneficial because the clinical viewer for 4DH increases patient safety, it reduces medical errors and adverse events, enhances decision-making, increases efficiency and effectiveness, and encourages patient-centered care, among other values as well. The course is suitable for the following people, including but not limited to healthcare professionals, that would be clinical providers, nursing staff, medical assistants, case managers, anyone essentially on a care team, health information management personnel, patient registration staff, and site managers. The learning objectives. So by the end of this training, the viewer should be able to define key terms, to list the 4DH access requirements, to explain the patient information sharing policy, and of course to use the clinical viewer, and that'll include logging in, searching for a patient, and then viewing the various aspects of patient health data that's available on the 4DH clinical viewer. To start out, some basic terminology for the 4DH. So 4DH, or the Four Directions Hub, is a unified community-wide care record that is compiled from data within the federal, tribal, and urban sites of IHS, as well as outside entities, and so that would be the VA for the purpose of the pilot and the initial enterprise rollout, which creates a single unified patient record. When we refer to the hub, this is the access and viewing of records that are internal to the Indian Health Service. And then the gateway references access and patient information originating outside of IHS through the eHealth Exchange, and that's where our partners such as the VA would come in. The clinical viewer is a web-based tool that enables IHS staff to access their patients' health information that is captured within IHS and across any participating outside organizations. In the future, a connection will exist with the Department of Veterans Affairs. The patient index, which is a separate user interface, not demonstrated in this training, but is also a web-based tool that identifies, compiles demographic information across various facilities, sites, and clinical administrative systems. This module will create the single best consolidated record for each patient from their local record information per site or facility. So I like to look at it as the backbone that makes up what then becomes viewable in the clinical viewer. In order to access 4DH, first and foremost, because it's web-based, access through a browser, and the preferred browser is Chrome. Microsoft Edge also is functional. We do not recommend Internet Explorer. It is not supported in all details of the clinical viewer. In order to gain access, the user would access their clinical viewer through their D1 Active Directory. And for purposes of training, users receive a separate login password for the demo server just for the training session. And to request access, there is an ITAC request form that the supervisor places. There's a procedure for this as well defined in supporting documents for the clinical viewer access. Getting to how patients consent to be part of the Four Directions Gateway. This is an important slide. It also gets a little bit tricky sometimes in nomenclature, so I'll do my best to explain it with some clarity. Four Directions Hub plans an opt-out policy for external exchange. And so opt-out means that it assumes that all patients would want their information available to their providers, but it offers them the opportunity to opt out if they do not want their information shared. And by this meaning shared outside of the IHS community through the gateway into the eHealth Exchange. Patient information will be shared unless the patient elects to opt out. Opt-out would be documented with the form IHS 912-1. And again, as I mentioned, this applies to sharing outside of IHS. And while this is the plan, Current IHS policy requires an opt-in approach, meaning that patients need to actively opt in using the form IHS 810 to have their information shared on the eHealth exchange externally. All information is shared internally through the 40H, and we'll continue to clarify on that. This Indian Health Manual changes and changes to the Notice of Privacy practices are underway. And again, as I mentioned, this policy applies to sharing outside of IHS with state exchanges, the VA, Department of Defense, etc. Clinical Viewer is a user interface where one can view medical information from the IHS RPMS, Resource and Patient Management System. This includes information like encounter diagnoses, medications, allergies, labs, imaging results, vital signs, procedures, etc., as they are provided by a document known as the CCDA. So information from RPMS is uploaded nightly via this document called the CCDA and goes into the 40H. You can view medical information from across participating IHS facilities in the 40H. You can view medical information from facilities outside of the IHS through the eHealth Exchange. eHealth Exchange is a large health information network, and it connects federal agencies and non-federal organizations. Data from outside of IHS can be viewed, but it's not saved. So I will demonstrate that in the Clinical Viewer demo, but the information is there for viewing. The current process is to document this information manually in the EHR as necessary. This is a graphical image of the 4 Directions hub. Again, this would include IHS internal, so IHS hospitals, clinics, offices, etc., all contributing through this nightly export of visit-based data into the 4 Directions hub. This next slide shows the bigger picture of the eHealth exchange. To the right of the screen, you'll see the IHS, and that's where the 4 Directions hub would be. And that information would then be communicated outwardly, as well as information from outside being brought in. Just to go back to that consent piece, this is where our current policy requires that patients would consent that their information would go outside of that IHS hub to eHealth exchange participants. My next part of the presentation is to give a demonstration of the clinical viewer. This will be a separate recording that we'll set up. In the meantime, this final slide shows the contact people for the clinical viewer. Should you have any questions, there are individuals' names as well as their emails. Thank you.